Liposuction. We're going to discuss a procedure that's the number 2 procedure in the world. Number 1 is breast. Number 2 is liposuction. So it's extraordinarily popular. And really, when this procedure came on board in the 90s or even 80s, nobody knew it would explode and be as comprehensive and as popular as it is today. Bottom line, with liposuction, you're taking a tiny little hole, putting a cannula in there, and removing the fat through suction. It's come across many different names: liposuction, liposculpting, lipocontouring. These are all different terms that people use for liposuction, and they just develop cute little acronyms. So liposculpting means that you're going to sculpt the body while you're removing fat. That's pretty much what we're doing today, because the procedures evolved from just removing fat. In the old days, we were marveled at the fact that I could just take fat out of you. We're like, whoa, look what we can do. But we didn't leave any natural anatomy behind. It was just a flat board that didn't really have a lot of look to it or aesthetics to it. And then we started developing techniques, we got more familiar with things, and then we started sculpting the body. Today, we're at a whole new level with liposuction, because I'm able to remove fat in areas that we want to remove from, and I highlight certain areas, and then we leave fat in certain areas on top of muscles to try to give it a little bit of a better look or a sculpted look. With liposuction today, we can create different types of appearances. So some people want like a Pilates look, where it's long and elongating the torso, a so-called Victoria's Secret model look. Others want a harsh, athletic look. Oh my God, make me look like I've been doing 500,000 sit-ups. Give me that boom, 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 six-pack look. Some people have a four-pack, some people have an 8-pack, but everybody likes the word six-pack. So we could definitely create that appearance. Or some people just say, I just want to be soft and elegant. I want to look great in a bikini. I don't want to have any lines or any definition. Just make me look pretty with less fat. And that's another look that we can get you. So it just really depends on what you want. However, there are several limitations with liposuction that we're going to encounter. Number 1 is, how much fat can we remove? So Florida has 2 rules. Rule number 1. If you're only doing liposuction, I can remove up to 4 liters of pure fat, called supernatant fat. That means that I can go to the areas that you traditionally want me to go to. However, it depends on how much fat you've got. I may or may not reach all the areas that you want. If I don't reach all the areas, then guess what? We can always come back 3 to 6 months later and do a little bit more liposuction, or there's always diet and exercise. Wah, wah, wah. I like liposuction because it can really contour the body, it can really reshape. So while it's not a weight loss procedure, it's a definite body contouring and reshaping procedure. So I can take full-figured women where most plastic surgeons won't operate on, and I say, listen, let me turn you into a voluptuous, curvy, full-figured woman, and I can completely reshape the body. So I love those procedures because they're so empowering to women. Bottom line is that when we do the liposuction, I am limited to 4 liters. Now, before I go on to the other rule, let me tell you, people always ask me, doctor, what can you do with the fat? Is it true that you can turn it into soap? I've never seen that, but I've heard about it in the movies. But what you can do with the fat is that I can use it to rejuvenate the body and augment certain parts that you want to make bigger. So for example, let's say you want to reshape the butt. I can reshape the butt. Let's say that you want to make the breast a little bit bigger. I can inject fat into the breast area. It won't increase it more than a cup size. To do that, you might need 1 or 2 surgeries. The amount of fat that stays when I did that is only about 30%, 40%. So if you're looking for a little bit of an augment, it's a wonderful procedure. In men, I can inject it into the pecs to give them more of an Adonis type of a look, their shoulders, their biceps, their triceps, their trapezius, their calves, their buttock. Ladies and gentlemen, there's another place where I can take the fat, and that's the private parts. So men are trying to make their bigger, and women sometimes want a little bit thicker fullness to the labia majora, or perhaps they want to increase the G-spot for sexual stimulation, or even the clitoral zone. Even injecting it into the vaginal walls, and it can help with incontinence, and it can sometimes traditionally help with lubrication of the vaginal walls. I can put the fat into the hands, I can put the fat into the face. Wherever you think of that is aging, lost volume, I can pretty much put fat in there. So fat is an amazing tool. All right, so enough about that. Let's go back to the rules. There's 2 rules. Remember, rule number 1, if I'm only doing liposuction, I can remove up to 4 liters. But rule number 2 says, now hold on. If you do another procedure at the same time that's cutting, like a breast augmentation, a tummy tuck, rhinoplasty, hair transplants, whatever, then I can only remove 1 liter. 1 liter usually allows me to contour the waist and the back. It just depends on how much fat you've got. But if you do want more fat removed later on down the road, you can always come back and get that done 3 to 6 months later. One popular thing that's going on is that people want to have a breast augmentation at the same time. So I could often do procedures that are short with quick recoveries, like noses, breast augmentations, breast lifts with augmentations, and do those one day and then come back 2 or 3 days later and then do the liposuction. Because the rules talk about doing it all in one day, but it doesn't talk about how far apart they need to be, and it's very safe to do it 1 or 2 days apart. So that's an option that you might have as well. It's totally up to you. So either you do the breast rhinoplasty or whatever that short procedure may be, buccal fat pad removal, whatever it may be, one day, and then 1 or 2 days later you do the lipo and fat grafting, or if you do it the other way around, where you do the lipo and fat grafting, the other small procedure or quicker recovery procedure, I need to wait 3 months because it's a harder recovery with the liposuction. So those are the 2 rules that we have, the 4 liter and the 1 liter limit. The other thing with liposuction that you got to take into consideration, I'm not only limited by the amount that I can take out by the Florida rules, there's other things that limit me. So the first thing that might limit me is your skin to fat characteristics. Why is that? When I remove your fat, I'm deflating the skin. So how that skin's going to retract back is going to totally depend on your skin characteristics. Do you have that skin that's nice and tight and it looks like spandex and it just comes right back and it looks like you never were there? Or do you have that skin that's really floppy and loose like an oversized shirt after losing weight? If you have that, boy, that skin's going to look horrible. It's going to wrinkle, it's going to fall over, it's going to overhang. I got to do a skin removing procedure, which involves a lot of cutting. So it depends on your skin quality. Sometimes you can't tell what the body's going to do. So some people fall in the definitive category of let's do lipo for sure because you're going to do good. Others fall in the category, hey, listen, for sure let's remove skin, like we need to do a buttock lift or a tummy tuck or a brachioplasty or whatever it may be. And many others fall right in between, where you're like, if you talk to some surgeons, they say let's do lipo only. Others might say let's do the tummy. I tend to leave it up to you in terms of what you would like. We can start off with lipo, see how the skin retracts, and then do the skin cutting later on down the road, about 6 months down the road. Or we can just do the tummy tuck with lipo and fat grafting at that time, if you so desire. Now, with liposuction, there's 2 things that I'm talking to people about that make a huge difference. The first one is called J-plasma. That's a new laser type device that I use during surgery, and it allows me to retract that skin and get me a tighter look. I'm loving it. It's extra when it comes to liposuction, but I think it's making a wonderful difference. The second thing is, you really want to hear this, it's for pain. It's called Exparel. I can only inject it during the lipo, I can't do it after. So it's got to be done during surgery, but it decreases the entire pain process by 80%. 80% usually for the entire process. You'll have discomfort, you'll feel tired, but it decreases the pain. So let's go back to the limitations. Number 1 was the rules, right? The 2 in Florida, the 4 liter and the 1 liter. Number 2 is your skin characteristics. Is it going to retract back? I do have technology to help me called the J-plasma, or is it going to be loose? The next thing is your fat characteristics. Sometimes your fat characteristics are such that when I put the cannula in and I bring it out, it leaves track marks and it makes it really ugly, and it's like that Tara Reid abdomen that you saw many years ago. It can be wrinkled, it could have a lot of irregularities, dimples, it can have all these things that are very weird appearing, and so you've got to be conservative with that. I do use a technique called safe lipo, and my buddy Simeon Wall taught us all that around the world. That's where you take the cannula and you break the fat up and then you suction. Take a look at it, look it up, it's called safe lipo. And I'm able to break that fat up and minimize those things. I mean, these irregularities could still happen no matter what. So number 1 is that your fat could have that characteristic that no matter what I do, it just leaves that irregularity. So imagine me running a cannula inside of water and pulling it out. It looks like it was never there. But imagine me running it through cheese. I put it in the cheese and I pull it out. Uh-oh, there's a hole in the cheese. It just doesn't have any give and take. Now, some fat is hard like concrete. Some fat is soft like butter. So it totally depends on your fat characteristics. The bottom line is that I've got to be really conservative in these cases, and I'm going to leave more fat than me and you would have liked, but I've got to do it for safety reasons and for aesthetic reasons. I never know what kind of fat you're going to have or skin characteristics in terms of retraction until I'm in surgery. And the skin, we won't know until about 2 to 3 months after surgery to see how it retracted. When I do liposuction, I gotta be careful with the skin as well because it can create burns. Some people are way more sensitive than others, especially smokers. Quit smoking because it can create burns on your skin, but we can't predict who's gonna have that issue either. The other thing with liposuction is that it can create fibrosis. That scar tissue that your body's gonna produce, it's hard, it's tight. You need massages to soften that up. You might need carboxytherapy if you do develop those things. Massages with liposuction, anywhere 5 to 15, it could be more, maybe less, but around there. So let me sum up the procedure a little bit for you. So the procedure will take me about an hour and a half. With the fat, remember, I can inject it into your buttock if you want. That's if you want, or other body part areas if you desire. It's not to make them bigger, it's to reshape it and make it prettier and perkier. And if you want size, we can definitely do that. So I'm gonna do the liposuction 1.5 hours. Gotta leave drains in. Those drains stay in for 5 to 7 days. Back to work is 7 to 10 days. I will put you in a garment. That garment stays on for about a month. Unless I'm concerned with your skin discoloration or your skin characteristics during surgery, I'll leave it off for a couple of days, but I'd say 99% of the time you're gonna get a garment and you're gonna put that on for about a month. Working out is about a month, laying out is about 2 months. If you do fat grafting, I have you protect the fat grafting. We'll teach you techniques on that. 6 months for your final result. In the beginning, you're gonna weigh more because you're swollen. Don't freak out if you see 5, 10, 15 pounds more, don't freak out. Your clothes won't fit because you're swollen. You gotta give me 2 to 3 weeks for all that to start to come down, and in about a month, a lot of it is down. Your definition, if you decided to go with the highlights, will take you about 3 to 6 months to really start to pop. So I really look forward to seeing you. Make sure you talk to your coordinator. She's very helpful. She'll go over all the other questions you may have. Hey, how much is it? Hey, how much is J-plasma or Exparel? When can I do this? What labs do I need? Do I need a medical clearance? Because safety is very important, so we do a lot of things to keep you safe. But they'll answer all that stuff, and they'll even go over financing if you want. So we really look forward to hearing from you, and I really look forward to seeing you. So definitely stay safe. Can't wait to see you.